Good afternoon, everyone. This is Jessica Weigel here from Deep Relief Massage Therapy, sharing another self-massage video. So today we're going to be talking about how to deal with arm pain. I know a lot of people are sitting at their desk, working at home, feeling all kinds of scrunched up and you can feel some numbing and tingling coming down the arm. So I'm going to give you some tips that you can do at home to help you manage the numbing and the tingling that's going on and explain a little bit why that it's happening. So we're going to be needing our cap from a jar. If you've been following my videos, you'll see I use this a lot to help you through self-massage. You can go through. So we're going to be starting at right below the collarbone. And the reason that this is important is because this area gets tight and compressed, and you can think of it as it basically cuts off the circulation going down the arm when your shoulder rolls forward this way and your collarbone gets all tight. So we're going to be working on opening up the collarbone into the shoulder to help get some circulation going back down the arm. So we're going to be starting at our sternum. I often refer to it as the midline. So we're right underneath our collarbone here. So we just go gently back and forth. Depending on the looseness of your skin, you may need to put your other hand just to hold the skin in place. And just go gently back and forth to the shoulder. And then you can go down to the next section and gently go back and forth to the shoulder. And if you feel still a little bit tight, you can just go back over to those sections that are bothering you. Just gently going back and forth. Because remember, the intention is to open up the chest and get some circulation moving along. So once you're feeling that's getting some relief, if it's getting a little bit red and pink, don't worry about it. That's kind of what we want. And if you're feeling like your skin is a little bit sensitive, you can use a carrier oil such as olive oil or coconut oil is generally what people have hanging around the house. You can apply a little bit of that to the area to help give you a little bit of a better glide. Now there is a trigger point right around here that can also cause shooting pain down to the arm and into the wrists. This happens a lot. This spot right here also happens a lot for people who are dealing with the frozen shoulder. So what we're doing right now can also help with frozen shoulder if you are in the unfreezing phase of frozen shoulder, which is going to be another video that I'm going to be planning on doing during this quarantine. So you're going to find your trigger point right around here. This is your deltoid. And just gently, if you can see, go up and down with the cap of your container. And if you find a spot that's bothering you, you can just hold it and just move the arm in different directions. Just gently do it. I don't want people going in and becoming overachievers and just digging in, because that can create more harm. Another area that can cause numbing and tingling down the arm is your front of your arm by your bicep. So you can start right at the shoulder and just gently go up and down. And if you find a spot, again, that is referring pain down the arm, you can just gently relax and contract that muscle while you're holding the point till you feel the relief, and then you can move on and go gently up and down to the next section. And usually right around here is another area that can cause problems. It's actually doing it to me right now, is it can refer pain down to the hands. Now this area can generally get tight and refer pain down to the hands if you're doing a lot of push-ups, shoulder work, if you're practicing a lot of yoga and doing a lot of planks and downward dogs and chaturanga. This area can refer pain. So if you feel a spot, again, hold it and just move the arm in multiple planes of direction till you feel the trigger point gently release. Now there's areas by the elbow that will also refer pain down to the hands and wrists, and that can also cause a lot of problems with people with their grip strength. So we're not going to be in the elbow, we're just going to be right below the elbow. So you're just going to stay right here. This area can refer a lot of pain down the wrists. And if or when you find a spot, this area you can just hold, and what you're going to want to do is you're going to want to pump your hand, and this can also help release the trigger point. And you should feel the muscle flexing and contracting. This helps to reset the nervous system and hopefully help this trigger point relax a little bit more. And then you can just move on to the next section gently, up and down. And if you find a spot, stay there and pump your hand so you feel the muscle relaxing and contracting. And the next section that we are going to be working on is we're going to be trying to get right in between these two bones right here, the radius and the ulna. There's a lot of bound up fascia and trigger points that can happen in between the radius and the ulna. And it's actually probably a little bit better if you put your arm on like a table, or here I have it on a railing so it lays flat like this for what we're going to do. So you take your cap and you start right at the wrist and you go right on up, trying to stay in between these two bones. And you're going to go right to the elbow, right to the general area that we were just working to release those trigger points. Now, for people that are working at home and typing a lot at home, this might take a little bit of coordination for some of you. Hopefully you can see what I'm doing. So you're going to flex the wrist up. And as you're gliding that cap up, you're going to want to slowly and gently bring the wrist down. So what we're doing is we're contracting the muscle while we're working it, and then we're stretching it while we're bringing it down. We're going to do that one more time. You're going to bring your wrist up, and as the cap is going up to the elbow, you're going to slowly bring your wrist right back down. Remember, staying right in between those two bones of the forearm. Okay, so that's all. That's enough to keep you busy for today, to hopefully help give you some relief from pain going down your arm from working at home. So if you have any questions about what I just posted, leave me a comment in the section below, or if there's something specific that you're struggling with while you're at home during quarantine, also post that in the comment section below. And I will see everyone for the next video. Have a great afternoon, everyone. Bye.